I want to talk to you quietly for a second, just you and me, because what I'm about to share with you is something most people never hear from their doctor. Not because it's a secret, but because there simply isn't time in a 15-minute appointment to explain it properly. I'm a board-certified internal medicine physician, and over the years, I've had patients come to me confused, frustrated, even a little scared, because their feet and ankles were swelling up every single evening, and nobody had ever told them why. Tonight, I'm going to fix that. Stay with me, because by the end of this video, you're going to understand exactly what's happening inside your body after dark. And I promise you, once you understand it, you'll never look at swollen feet the same way again. Let me tell you about a patient I'll call Margaret. Margaret was 68 years old. She exercised. She watched what she ate. She thought she was doing everything right. One morning, she woke up and her ankles were so swollen she couldn't get her shoes on. Both of them, tight like balloons. She told me she sat on the edge of her bed and just stared at them. Because the night before, they had looked completely normal. She came into my office terrified. She thought she was having a heart attack. She thought her kidneys were failing. She was already imagining the worst. And here's the thing. Her fear wasn't crazy. Because untreated nighttime swelling in people over 60 can be a warning sign of something serious happening deep inside the circulatory system. Something that, if you don't understand it, can silently get worse for years. But once I explained to Margaret what was actually happening, she wasn't scared anymore. She was empowered. And today, I want to give you that same explanation. So let's start with the why, because this is what nobody ever takes the time to explain. Your circulatory system is like a two-way highway. Your heart pumps blood down through your arteries to your feet. Then your veins are supposed to bring it all back up, against gravity. Now here's where it gets interesting. When you're young, your vein walls are strong and elastic. They have tiny one-way valves inside them, like little trap doors, that push blood upward and prevent it from pooling back down. But after 60, two things happen. First, those vein walls start to lose their elasticity. They become a little looser, a little more relaxed. Just like skin changes over time, the walls of your blood vessels change too. Second, those tiny valves, the trap doors, start to weaken. So instead of snapping shut and keeping blood moving upward, they let small amounts of fluid seep backward, down toward your feet. Now, here's the piece most people miss. And this is the clinic secret I mentioned earlier. This backward fluid leak doesn't happen all at once. It happens gradually throughout the day. Every hour you sit, every step you take, gravity is slowly winning. Fluid creeps down, and by nighttime, you've got swollen ankles. This is called chronic venous insufficiency, and it's not a rare disease. It affects an estimated 40% of people over the age of 60. Now, before you panic, this is not the same as a blood clot. It's not the same as heart failure. But left unaddressed, it can worsen over time and open the door to more serious complications. And I'll tell you exactly what those are in just a moment. But wait, why is it specifically worse at night? Why don't your feet swell up first thing in the morning? Think about what you do all day. You sit, you stand, you move around. Every single hour, gravity is pulling fluid downward into your lower legs. It's a slow accumulation, like a bathtub filling up a drop at a time. By the time evening arrives, after 12, 14, sometimes 16 hours of upright activity, you've hit peak fluid accumulation. The bathtub is full. And here's something fascinating. When you finally lie down at night, your body starts doing its job again. It begins redistributing that fluid back upward, back toward your heart, back toward your kidneys, which process it out. Some people actually notice they urinate more at night for this exact reason. Their kidneys are handling the fluid your legs just returned. That's why by morning, the swelling is often gone, or at least much better. Your body literally worked the night shift to fix it. Now, I promised I'd tell you when nighttime swelling crosses the line from normal aging to something you need to take seriously. Here are the signs I want you to watch for. Number 1, swelling in only one leg. Swelling in both legs from venous insufficiency is common, but swelling in just one leg, especially with warmth, redness, or tenderness, can be a sign of a deep vein thrombosis. A blood clot. That is a medical emergency. Do not wait. Number 2, swelling that's accompanied by shortness of breath, especially when lying flat. This combination can indicate fluid backing up into the lungs, a sign the heart may be struggling. That's not something to sleep on. Number 3, skin changes. If the skin over your ankles is becoming darker, thicker, or developing small open sores, that tells me the tissue itself is being damaged by chronic poor circulation. This is called venous stasis dermatitis, and it can progress to wounds that are very difficult to heal. If any of these apply to you, please see your doctor. This is not the time to watch more YouTube videos. But if your swelling is typical evening accumulation, the kind I described earlier, I'm going to share with you exactly what I recommend to my own patients to slow it down, and in many cases, reverse it. Coming up right now. These are the exact recommendations I give my patients in the clinic, and most of them are surprised when I tell them this, because they expected a prescription. But the most powerful tools are often the simplest ones. Clinic secret number 1, compression stockings, but worn the right way. Most people either don't use them or they put them on mid-afternoon when the swelling is already bad. Here's what I tell my patients. Put them on within 15 minutes of waking up, before you even stand up, before gravity starts winning. That's when you have the most control over what happens to your legs that day. Clinic secret number 2, the evening elevation rule. Elevate your legs above the level of your heart for 20 to 30 minutes in the late afternoon. Before dinner, not after. Most people wait until bedtime, but by then the fluid has been sitting in your tissues for hours. Getting ahead of it in the afternoon is dramatically more effective. Clinic secret number 3, the walking effect. Your calf muscles are your second heart. Every time you walk, those muscles squeeze your veins and pump blood back up toward your heart. Even 10 minutes of walking after meals can reduce evening swelling significantly. I've seen patients cut their swelling in half just by adding a short after-dinner walk. Clinic secret number 4, watch your salt. But it's not what you think. Everyone knows about salt, but here's what they don't tell you. It's not just the salt shaker. It's the hidden sodium in canned soups, deli meats, and condiments, the kind most seniors eat daily because they're convenient. If it comes in a can or a package and you didn't cook it yourself, read the sodium label before you eat it. Clinic secret number 5, magnesium. This is the one that surprises people most. Magnesium plays a direct role in vascular tone, in how well your blood vessels contract and relax. Many people over 60 are quietly deficient in magnesium and don't know it. Talk to your doctor about whether a magnesium supplement might be appropriate for you. Remember Margaret, the patient I told you about at the beginning? She went home with these exact 5 recommendations. She started compression stockings in the morning. She added a short afternoon walk. She swapped her canned soups for something lower sodium. 6 weeks later, she came back into the office. She was wearing her regular shoes. No swelling. And she had tears in her eyes. Not because something was wrong, but because she finally understood her own body. That's what I want for you. Not just relief from the swelling, but understanding. Because when you understand what your body is doing and why, you stop being afraid of it. You start working with it. You are not powerless here. Your body is doing its best. It just needs a little more support after 60. And now you know exactly how to give it that. If this video helped you understand something about your body that nobody ever took the time to explain, I'd love it if you subscribed. I post new videos every week focused on the health issues that matter most to people over 60. And if you know someone whose ankles have been swelling up every evening, share this with them. It might be exactly what they needed to hear. I'll see you in the next one.